And thank you all for coming tonight and allowing me to speak as one of the panelists on this very important topic. My objectives are to clarify the role that our skin, or epidermis, plays in keeping us healthy, to elucidate the benefits and consequences of ultraviolet radiation, to shed some light on the amount of ultraviolet B that's necessary to produce vitamin D, and to highlight how variations of skin and quantities of melanin influence health and vitamin D production. The skin is the largest organ in the body. It's only millimeters thick. It's very complex. There's the epidermal layer, which is the most superficial layer which we can see and in which reside pigments. The basal layer underneath that is the dermis, where the nerve roots and the blood vessels and the sweat glands reside. Take good care of your skin. The same thing applies to if you're diabetic, the kinds of things that you need to eat or to prevent diabetes. A healthy diet is really important for the skin. Plenty of fresh fruits and vegetables. I tell my patients to eat the rainbow, and I don't mean Skittles. And treat the skin gently. I don't think we realize how much long, hot showers damage our skin. Likewise, harsher soaps and detergents can strip those oils from our skin, so you're encouraged to find more mild cleansers. I think the variations in coloration of our skin are some of the most fascinating things about the epidermal layer. I want to emphasize, though, that ultraviolet radiation from the sun, it poses a double-edged sword for us. Too much of it causes the aging and the risk of skin cancer. However, too little of it, the flip side of the coin, is also equally important and maybe something that we don't focus on quite enough. So we do need sun to do some good things for us. When is the UV index the most dangerous? Basically when you're standing on your shadow. If your shadow is shorter than you are, the sun is high in the sky, that's the time when both UVA rays and UVB rays penetrate through the skin at a more steep angle and more dangerous to the skin. A little word on SPF, sun protection factor. You've no doubt seen this as you're shopping for sunblocks and whatnot. So an SPF of 15 means you multiply your burn time by 15. So an SPF of 15 for me at a burn time of, say, 10 minutes would buy me about 150 minutes in the sun without as much risk. The key point is that most SPF protects you from that midday sun, that ultraviolet B radiation time. It doesn't protect us very much at all from the UVA rays. So what do? We look for a blocker that's a little bit more wider spectrum. And the zinc oxide ointments and creams, they do a little bit better protection from the all-day sun exposure, the A and the B. Those varying degrees of pigmentation are what scientifically we refer to as phototypes. This is sort of an attempt to gauge a patient's quantity of melanin as a biomarker for health. Melanin is skin deep. It's that granule of pigmentation, a chemical that lies in the skin surface, right there between the dermal and the epidermal layer. Melanin actually acts as a sunscreen. It is basically built-in SPF. Again, darker skin pigmentation helps protect from the harmful effects of the sun, but it requires longer exposure times and surface area for the production of vitamin D. Paying attention to vitamin D, melanin, sun exposure, all that is a very interesting area to me, and I hope that you share that as well.